Medicaid could be in danger as the Republican-led Congress seeks to cut spending in their upcoming budget. Physicians in the Commonwealth spoke out today, encouraging their representatives to preserve the program that they call critical to vulnerable Virginians. Here's Connor Reel with more.
Dr. Rick Manolio says he's seen firsthand how Medicaid benefits his patients.
Transforms lives. It allows people to manage chronic conditions, avoid serious complications, and remain active in their families and community.
He's also seen the flip side when a patient doesn't have access to affordable care.
Treatable conditions become life-threatening. Uncontrolled diabetes leads to blindness and amputations. High blood pressure causes kidney disease, strokes, and too often death.
And Dr. Joan Lingen, the chief medical officer at Eastern Shore Rural Health, says Medicaid is especially critical for community health centers. And without that revenue, they may have to cut back on services. Last week, the U.S. House passed a budget blueprint that seeks at least $1.5 trillion in cuts the next 10 years to federal programs and services, including Medicaid.
On the Eastern Shore, we have one hospital for a 70-mile peninsula. If we were to lose our hospital, it would severely impact the health of this community.
While the budget must still pass the U.S. Senate, and it's unclear what the potential final Medicaid cuts would be, Dr. Susan DiGiovanni concludes that Medicaid could actually save healthcare costs in the long run.
It can cover a lot of preventative services and treat illnesses early on. And when you don't do that, what happens is you end up treating a lot of illnesses at their end stage, which drives up costs.
I'm Connor Reel, 13 News Now.
All right, we reached out to U.S. Representatives Jen Kiggins and Rob Whitman, who voted in support of the House budget blueprint. Congressman Whitman released a statement saying, in part, no one has proposed or voted on cuts to Medicaid. That's why we must act now to strengthen the program. To preserve Medicaid, we need to focus on rooting out waste, fraud, and abuse within the system. But Democrats say the proposed budget could lead to deep cuts in Medicaid.